is shows us that the kingdom is in the right path. And I'm very happy to be sharing this with you. Thank you very much.
Thank you, Mr. Sushant, for this good review for the 5 disciplines of innovation. Our next speaker will be Dr. Sultan Qahtani. Dr. Sultan Qahtani is a graduate of King Saud University in Abha. He did his residency and fellowship in Montreal, McGill University. His fellowship was in neuroradiology. He is certified by the Canadian for both the specialty and the subspecialty. He is currently the chairman of Neurointerventional and Diagnostic Neuroradiology Department. He is also subspecialty of Interventional and Diagnostic Neuroradiology in KFMC. He has a lot of expertise, including cerebral aneurysms, vascular malformation, immobilization, and epistaxis immobilization, vasculoplasty. Dr. Sultan will talk for the coming 15 to 20 minutes on flow diverters technology. Dr. Sultan.
Assalamu alaikum wa rahmatullah. Thank you, Mr. Chairman. Thank you for the organizing committee. First, I take the opportunity to thank the KFMC administrations and the related departments, Medical Imaging Administration, Neuroscience Administration, and the anesthesia people who are always in collaboration with us. Today I'm going to talk about new technology that's been helped us a lot in the treatment of complex neurovascular cases. We are talking first about the flow diverter technology. Flow diverter technology rules in the neuroendovascular treatment of cerebral disorders. Flow diverters really it means is a new kind of stent. These kind of stents are a new device that has been developed over the last 3 years. This is the latest technology for the intracranial aneurysm treatment. It is made up of 75% cobalt, chromium, and 25% platinum. So what this stent does, we get this stent from the groin of the patient, going up to the brain vessels and deploy it and try to treat the cerebral abnormalities, whether aneurysm or any defect. And diverters come from to retain the normal flow of blood to the normal circulation instead of abnormal location. So it is the latest technology and is the cutting edge endovascular device. It's FDA approved for intracranial vascular anomalies treatment. It is in clinical practice for the last 2 years. And actually KFMC is one of the first few centers in the world which approved for its use. This is what we used to do. This is the kind of model for the blood vessel. Actually, the pointer is red and this is red, so it may be difficult to see. But this is the normal vessel, and this is the outpouching, is the abnormality, what happens in the vessel. And this is what we used to do, or currently we are using globally, that this aneurysm can be clipped by the surgeon with a craniotomy. This aneurysm can be coiled, filled. But the new technology is to place a new device within the normal vessel and exclude the flow to the abnormal location. What's going to happen afterwards, since this is a new stent, it's not a regular stent that we use like in the coronary or any place, but this new stent will create gradual flow reduction in this aneurysm and will be progressive thrombosis, and this is going to be shrink. We deployed for the last 2 years 34 pipeline stent intracranial devices, and we have no failure and 0 complication for these patients. what's the principle here? Can we utilize this technology? Actually, we adopt this technology and we treat aneurysm. The other thing we want to think about outside the box, can we treat different complex intracranial problems using this kind of technology? Or can we modify it to be helpful to treat this kind of conditions? Actually, at the KFMC, we are either fortunate or unfortunate to face very complex vascular malformations. And we have to face this reality because these cases can be critical, carry a devastating and lethal outcomes if not dealt with appropriately. So we create a theory that this device that we use for aneurysm, it can be used for certain complex pathology like carotid cavernous fistula. Carotid cavernous fistula is intracranial abnormal communication between the carotid artery and the cavernous sinus. And the blood, instead of going to the brain, it goes to the extracranial circulation. And this is not really treated, it may have bad sequences in the patient. Patient may have a stroke because no enough blood going to the brain. Patient may bleed intracranially. Patient may bleed extracranially. So there is quite limited experience in the world. However, the technology used for treat this kind of cases are quite classic. But there are certain conditions that cannot be treated unless otherwise we think further. And we felt that this technique will be helpful for this kind of cases. So we adapt really this technology for treatment of this abnormality. And the basic science tells us that the flow hemodynamics intracranially is very different from the extracranial circulation. And there is a significant science behind this. If we go through the really scientific background, it will take hours and hours, but there is a quite resistive index of 70% less for the blood intracranial circulation versus extracranial, which make these devices works well. So by interrupting the index of resistance, the flow will restore normally and divert from the abnormal location. I'll show you a video here to show it is a model to show how this device works. This is called pipeline. This is the trade name for it. And this is the patient brain. This is the vasculature concentrating the red, which appears to be the vessel. And this sac is the abnormality here. So this is the flow which shows the abnormal location here. We want to divert this portion from the abnormal location and restore the normal circulation. We go through the vessels from the groin without opening the head with the microcatheter, which are maybe 10 times less than magnification here. This is too magnified here. And this microwire, the stent or the pipeline or the flow diverter will be within this tube, which is very small. And once you remove the tube, it will dilate and will occlude the neck of the abnormal aneurysm with maintaining the normal branches patent. And this comes the rule of the God creation, which is the low resistive index of the brain circulation, allowing the normal branch to be open and the abnormal sac will be occluded. Now we go in, we take this device and leave the stent on location. So by taking out the whole device, the stent will stay in, and will be residual flow. The flow will go back through normal vessels, and there will be less flow within the aneurysm and gradual occlusion. So now getting less and less. Less and less, and this is eventually will thrombose and get shrink. And now we'll go back to the normal. So this is the angio suite that we do this kind of procedure in. And now if we go to give you a few examples of patients that we treat. This is a 38 years old woman. She's a mother of 8 children, and she's 35 weeks pregnant. And she came with a progressive left side weakness, right side weakness actually. And this is the CT scan of her brain. This is the eyes, this is the brain, and this is out pouch. The bright thing is dilated blood vessel. And this is what we see. There is a huge dilated abnormal blood vessel compressing the brain stem, which is very critical for the patient. This part, if you do MRI, this is the orbits, this is the axial brain tissue, and this is the abnormal vessel dilatation. If you look here, this is the abnormality. This is causing compression. The problem with this location is very critical for open surgery or for endovascular approach. So we have to be either to leave this patient to rupture and die, especially if she is going under course of birth within few weeks, or try to help her. So this patient, we advise to do cesarean section for her to get her baby survived. And we do angio for her. Angio is to see the blood vessels only, and the computer will eliminate all the structures of the head, the brain, the bone, everything is out, and only what we see now is the blood vessels, which labeled the red in the model. So this is the abnormality, and we try to isolate this portion from the normal circulation. And this is what we have done. We just occlude the neck of this portion and leave all the branches alive to avoid the patient's stroke. And this is what we got. This is before, and this is after. We just, as if we, exclude the neck of the aneurysm, completely gone, all normal branches are available. And this is the CT scan 6 months later. The aneurysm completely gone, and she just left with a normal brain, and she is alive and her baby alive. So if you go to this is another case, which is 48 years old lady, and this is again, if you look, the good thing about the brain, there are two hemispheres, and they're quite identical, and there is quite mirror image. If you look, take a half here, and there is abnormal black dots here, which is dilated vessel. If you look here, that's the abnormal dilated vessel. If you leave this patient to rupture, there will be 50% chance the patient will die before hospital arrival. So this patient, how many stories you hear about people getting very bad headache and died? Many stories happens, and doesn't exclude whether you are a top VIP, president, or low ranking person. Mr. Sharon, he suffered the same thing, ruptured, and the grand of former President Hosni Mubarak, grandson has ruptured aneurysm and he has died. So this patient has to be available for everybody, and there is no way to wait. So we did the place thing. This is the lateral images of this patient, and we did stenting, and we put the pipeline. We exclude the aneurysm from the circulation, and she's okay. So now we go to the fistula that we are supposed to treat, and this is again the model, and this is the abnormal vessels. Abnormal, the blood's supposed to go to the brain, and this is abnormal thing. If you go to this portion, I'll give you what's normal. This is the normal flow of blood to the brain, and that's fine. And this is abnormal, so the blood comes here and has in a sac flow, shunt outside the brain. This is the eye here, and this patient will have eye bulge, and the blood instead of going to the brain, it will divert somewhere else. So we have to shut down this shunt. So this is what we did for this patient. He's a young man, he has puffy eyes, puffy face, looks even depressed because this patient visited all the ophthalmologists in town, and nobody gave him an advice except somebody felt brew in his eyes, and eventually he came to us. We did the treatment, we restored the normal blood flow to the brain. All the veins congested affecting the eye and the face had been disappeared, and this is next day actually. The whole puffy face has gone, the eye restored, and the divergent squint has restored back. Within 24 hours, this patient can go home. Actually, this is the CT scan, shows the stents, but I think it's beyond your interest here. Again, this patient had the same thing. We see motor vehicle accident here, very common, and we see all this kind of cases. This is the patient post-treatment. Give you an example. This is another case. This patient you see these tortuous things here. This is the head. This is the blood vessel dilated. This is the blood vessel herniated through the skull base to the sphenoid sinus. And there is no other mean to treat this thing. If anybody touch this portion, this patient may bleed till death. This is what we did. We shunt him. We placed a stent along the shunt level. And this is the patient next day. This is the patient came with this puffy eye, red eye, depressed face, all the faces, divergent squint, and this is the next day. He is actually dressed to go home. I called this 6 months later to come to follow up. He said, I don't want to see you again. I'm okay. This is one of the cases that we did. Actually, they are young men, and they are quite healthy. Whenever we treat these cases, they really go home in a good condition. This is one of the cases that we did. Second day, he went home. I could see many examples here. One of the aneurysms that this patient came with the bleeding, and actually he bled in the brain. This is the blood, this is the blood. And this patient said, as we said, there is very likelihood to die if they ignored. And this patient have this small aneurysm. And this, if it's ruptured again, this can be catastrophic. So we just place a pipeline with the new stent along this aneurysm. And this 6 months follow-up, this is the abnormal portion after the stent completely restored normal vessels, and the whole aneurysm has disappeared. Again, this is a 50+ years old man who came with the progressive weakness, and in private hospital, they think about cervical region. So they did cervical MRI, which was okay, but somebody noticed something in the intracranial, compressing the brainstem. And if you do MRI of the brain, you see the brainstem, quite acute hematoma here, compressing the brainstem. If this ruptured, we don't see the patient again. So this is the aneurysm here, okay? This is the aneurysm here. With the help of our neurovascular team, we talk. We try to discuss and treat this patient. Actually, this case has been around the globe, and the best centers in the globe have been consulted, and everybody at the end of the statement, good luck with your patient, because it's very complex to get this patient treated. This is the basilar artery, which is considered to be the highest risk vessel in the human body, and this is the vertebral arteries. And this is very complex for endovascular neurosurgeons or for the classical surgeons. So we managed to try to have different techniques that we could cross this portion with the X technique, place a stent across the neck, and try to occlude the sac of the aneurysm. We place the stent, and actually this is start to resolve and can disappear, and we do this left side start to disappear as well. So the main thing is to restore and normalize this vessel and exclude the aneurysm from the normal circulation. This is what we did. Finally, the whole normal vessels are restored, the aneurysm is completely gone, and the patient is quite healthy. So this is a pre, and this is post. This is normal circulation restored, and this is the abnormal part, which is very risky. Get away. So in conclusion, KFMC really, which is part of it, is one of the first centers in the world used or adopt the pipeline flow technology for treatment of intracranial, actually the complex intracranial aneurysm with the maximum safety. And KFMC is the first center in the world to use successfully the flow diverters for the carotid cavernous fistula treatment. And it's accepted by the international neuroendovascular surgeon community as the treatment of choice for the complex carotid cavernous fistula. Thank you very much.